Hi, Dr. Kevin Zorn, BPH Canada, founder and director. I'm here at the AUA. We're going to go through a demonstration of a UroCuff test, which is a new technology we're bringing into our office to help be more precise and better BPH care. So let's do a demonstration. So, start study. So this would be a simulation, real time, of a demonstration patient where they'll be brought to the bathroom. They'll place on their tip of the penis an external cuff that they'll urinate through. So here we see the initiation of the urination, and to which at real time, every 3 seconds, there's cycles, kind of like a blood pressure cuff, that's going to apply some gentle pressure, not to the penis, but to the urinary flow just in front of the penis through the cylinder. And what that's going to do is going to allow the computer to generate an indirect measure of the contractility, the force of the bladder. So we call that PDET, the pressure of the detrusor, which will allow us to know, is the bladder working harder to generate the same flow, or are we getting worse in BPH and that the bladder's becoming weaker? And this will help us judge in which we should maybe move to a different therapy outside of medications to prevent urinary retention. All right, so after having urinated, the patient, you can see on the left, there's multiple pressure readings. That's the uroflow, the standard report that we would get with a uroflow. But what are we getting different in the UroCuff? Well, you can see that during the pressure readings, we're able to generate what kind of detrusor contractility is going on. Normally, the bladder can provide a certain amount of centimeters of water, but if it's having to work extra hard to generate a flow, in this case, high pressure, low urinary flow, not good for the bladder. So this is, functional. We call it compensatory, to which a patient's bladder initially, like going to the gym, will get thicker. It'll work harder to generate a flow, and eventually that bladder can tire out and the gentleman goes into retention. So the report that we'll generate to the patient will include 4 boxes. Either you're in the green area, normal flow, and good pressure, or are you generating high pressure with a normal flow? And this is the area where we start getting worried. A patient has very high flow and very high pressure and low flow. The worst situation is the bladder's not really contracting anymore. We have a burnout bladder, and unfortunately, patients won't do well and they'll fall into retention. So these are some of the really cool metrics that we can help perhaps get earlier into the care of patients and make sure that they don't fall in retention and get earlier access to patient care and get better outcomes.